Good day to everyone. Visual diagnosis, red complexion color. A red complexion always indicates heat, which may be full or empty. It indicates empty heat, particularly when only the cheeks are red. Redness of the complexion also indicates empty heat when it is somewhat thin or superficial as defined above. The clinical significance of the red complexion depends also on the location of the redness. There are three main types of red complexion. One, red cheeks. Two, red cheekbone. Three, clothing red. On red cheeks, in this case, the facial complexion is too red and the redness is located all over the cheeks. In some cases, one cheek may be redder than the other, and usually the right cheek reflects the condition of the lungs, while the left one reflects the condition of the liver. And this one is the example of red cheeks, this picture. Red cheeks. A red facial complexion usually indicates full heat, which may pertain to various organs, especially the heart, lungs, liver, or stomach. In the case of full heat, the whole cheeks are of full red color. In some cases, a red complexion may be seen in empty heat, in which case the red color looks thinner and it may come and go. Red cheekbones, in this case, only the cheekbones are red and the color is usually thinner than that of full heat. The redness of cheekbones may come and go, and often it appears only in the afternoon or evening. This picture is an example of red cheekbones. This one also. Red cheekbone always indicate empty heat, which may affect various organs, especially the lungs, heart, stomach, and kidneys. The clinical significance may be further differentiated according to the type of redness and to the time of day when it appears. A relatively thin red color that looks like makeup and appears in the afternoon indicates blood deficiency. If both cheekbones are deep red, it indicates empty heat. If both cheekbones are fresh, red like threads, it indicates yin deficiency. If both cheekbones are pale red, it indicates steaming from bones due to chronic yin deficiency. Note, do not assume that red cheekbones always indicate yin deficiency. They may also indicate blood deficiency, especially if obvious in the afternoon. It's common in women. Floating red. The floating red color is a thin, floating, pale red that looks like rough and may move from place to place. This picture is an example of floating red complexion color. The floating red color generally indicates empty heat. It is seen also in the pattern characterized by pulse heat and true cold, which means that the patient suffers from severe internal cold and the separation of yin and yang, which makes yang float to the top, giving the false appearance of heat. In fact, apart from the redness of the face, all the other signs and symptoms point to internal cold, cold limbs, desire to curl up, weak breathing, pale and short tongue, and slow pulse. However, this situation is rather rare. Thin red complexion color is in the picture. Thick red complexion color. Superficial red complexion color. And deep red complexion color. distinct red complexion color, obscure red complexion color. In red complexion, red cheeks, full heat in heart, lungs, liver, and stomach organ. Red cheekbones, empty heat in lungs, heart, stomach, kidneys, or it is a blood deficiency. Floating red, empty heat, or false heat through cold. Bright red face, feeling of heat, thirst, mental restlessness, red tongue with yellow coating, overflowing rapid pulse. Heat of any organ may cause of red face, but especially of the heart, lungs, liver, and stomach. This is a full heat. In acupuncture, heart, liver, liver 2, stomach 44, lungs, lung 10. Liver young rising, slightly red face, headache, dizziness, tinnitus, irritability, propensity to outburst of anger with wiry pulse. In acupuncture, liver 3, gallbladder 20, ureter 5, and gallbladder 43. In damp heat, red face, swollen face, greasy skin, epigastric fullness, sticky taste, thirst with no desire to drink, feeling of heaviness of the head and body, feeling of heat, sticky yellow tongue coating, slippery rapid pulse. In acupuncture, large intestine 11, LI4, REN 12, REN 9, spleen 9, REN 5, and bladder 22. Yin deficiency with empty heat. Malar flash, feeling of heat in the evening, night sweating, mental restlessness, 5 palm heat, red tongue without coating, rapid and floating empty pulse. This may be empty heat of any organ, but especially of the stomach, heart, lung, kidneys, spleen, and liver. In acupuncture, spleen 6, REN 12, REN 4, kidney 3, to nourish yin. Also, in heart, heart 6, liver 2, in lungs, lung 10, stomach 44, spleen 2, and kidney 2. Blood deficiency with empty heat, floating red cheekbones, dull pale complexion, blurred vision, dizziness, scanty period, amenorrhea, insomnia, pale tongue, choppy or fine pulse. Empty heat deriving from blood deficiency is usually seen only in women. And although it may cause the cheekbones to become red, it also not usually associated with other heat symptoms such as thirst or a feeling of heat. Yin fire, slightly red face or pale face with a floating red color on the cheeks. Intermittent and recurrent feeling of heat in the face but cold limbs. Intermittent sore throat, dry mouth, dry lips, mouth ulcers, exhaustion, poor appetite, poor digestion, weak limbs, pale tongue, weak or overflowing empty pulse. Yin fire is a pathological minister fire that arises when the original chi or the yuan chi becomes depleted from overwork because the minister of fire and the original chi resides in the same place. The pathological minister fire robs the original chi and rises to the head. This pattern is treated by tonifying the original chi and lightly clearing heat, and the representative prescription is Buzong Yi Titang, a tonifying center and benefiting chi decoction. Invasion of wind heat. Red face, aversion to cold, fever, cough, sore throat, stuff or runny nose with yellow discharge, headache, body ache, slightly sweating, slightly thirst, swollen tonsils, tongue slightly red on the sides, in the chest area, or on the front part. Then the pulse is floating rapid. Deficient young floating. Malar flash, feeling of heat, likes to remove clothes, thirst with desire to drink warm liquids, light shortness of breath, cold sweating, cold limbs, pale, pale urine, pale lips, pale tongue, weak pulse. This condition is quite rare. It results when the young is so weak that what little young there is floats upwards. Thank you for your attention.